So Dr. Durkin, thank you so much for taking the time to sit down and have this conversation with me. For those who are unfamiliar with you, could you tell us a little bit about yourself and your practice, Ocean Drive Plastic Surgery?
Sure, absolutely. So my name is Alan Durkin. I am a board-certified plastic and reconstructive surgeon. I am the founder of Ocean Drive Plastic Surgery, Dermatology and Med Spa. We are a boutique destination plastic surgery practice on the Treasure Coast of Florida in Vero Beach. One of the things we like to say is our operating room is literally 50 yards from where the water hits the sand. So we specialize primarily in facial aesthetics, surgical, non-surgical facial aesthetics, comprehensive laser therapy, complex breast issues, and body contouring. We're lucky we have two board-certified plastic surgeons, myself, Dr. Jimmy Chim. We have two physician associate dermatologists on the dermatology side, 6 estheticians, 1 massage therapist, and a bunch of just fabulous humans that makes it all work for all of us. Been there since 2011.
Wow, it sounds wonderful. What was the original vision behind opening your practice?
So what we wanted to create, we believe that obviously plastic surgery should have a result, but that result should be provided in a consistent and meaningful experience. People don't come to my practice because they have to, like in mainstream medicine. They come to my practice because they want to. We want to double down on that. We wanted to create a truly unique experience and have it be as opulent and luxurious as possible. And so when we had an opportunity on the Treasure Coast of Florida, we leaped at that. So what we have spent our last decade is really elevating and optimizing not just our surgical results, our safety protocols, but our experiential protocols. We take sincere pride in making sure that our staff is soup to nuts in that Nordstrom's mentality rather than in that fast food mentality that you sometimes find in mainstream medical practices. That was our big focus. The other thing with the spa and with the dermatology component is we wanted to make that experience throughout the entire realm of aesthetics. The future is going to be just as much non-surgical as it is surgical if it isn't there already. We need to be experts in both, and we need to know how to hybridize both to make sure that we're selling a result rather than a procedure, and we're providing that result with the least amount of surgery and risk.
When was it when you decided to pivot from just your traditional practice, so to speak, to your med spa network?
So Med Spa Network is really an outcropping of what our vision is and what we perceive is a need in aesthetics. The overarching reality is there is so much demand for these services that dermatology and plastic surgery do not have enough practitioners to cover it. And you can see this in the marketplace every day. There are new people entering the aesthetic arena from a practitioner standpoint by the minute, not by the hour. It's happening minutes. And these are good people, and they require the opportunity to shine. And to get there, training is indicated. In the absence of training, you're forced to guess. With the benefit of training, regardless of credentials, you get to be an expert. We created Med Spa Network to fill that gap. The reality is none of these people should ever have to fear the job that they're providing. And in medicine, everyone knows once you understand how things work, the job gets real fun. But until you get there, it's dangerous and it's unsafe and it's really not enjoyable. Med Spa Network is designed to provide world-class training and elevate people's practices in a safe fashion so they can sell results rather than procedures. And they can do that with confidence and safety.
And when you mentioned the original vision of filling that gap, did you feel like the gap was more in the industry, that there wasn't enough education? Or is it more that you had this vision of really elevating, helping other physicians elevate their practice even to a higher level?
So it's a fabulous question, Milan. The reality is when I speak with industry, they want the same thing I want. They want more training for more people, and they want that training to be effective, safe, and meaningful. When I speak to practitioners, they also want it, but they're not getting it from your traditional university model. Unless you're in plastic surgery or dermatology, there is no pathway towards aesthetic training, none whatsoever. So all the men and women that are privileged to meet at Med Spa Network, they got there through hustle, through grit, and they're picking up knowledge through asymmetric pathways. We are trying to make that a very symmetric pathway, and we want to double down on the hustle and grit that they already have. We just want to give them the best possible resource to put that grit towards their outcomes.
Sure, sure.
That's our plan.
And can you talk about some of the classes that you have either coming up or in the past?
Yes. So we have three options. One is there's an online platform. That's a subscription model, just a monthly fee. It's got soup to nuts, different videos, different modules. It's going to get you safer than you probably currently are and more effective. The second opportunity that exists is for specific partners with our network. We will provide on-site training. But the big thing that we really love to do is quarterly, especially in combination with our industry partners, we have a hands-on 2-day cadaver lab course with live injections. We have one coming up fairly quickly in the next few months. It's going to be our first one since the pandemic restrictions lifted. We are absolutely beyond excited. So that program will be have 10 cadavers. We have 10 faculty members from all over the United States, and specifically if they're from different credentialing backgrounds. So there's 2 board-certified plastic surgeons. There are 3 CRNAs, 2 physician associates, and 2 RN injectors. We want to get different perspectives on this, put them in front of everyone, show live injections, discuss the facts. Everybody's up to their own opinions, but the facts in medicine are pretty static, and that's especially true in surgery and aesthetics. We need to make sure people have the right facts, so that way they can create the right opinions and their own nuances. And then they can come back and teach us how to fix what we're doing wrong in here.
Sure.
That's our plan. So we rented out the Nicholson Center at the University of Central Florida in Orlando, Florida for June 23rd. That day we're going to have 6 hours of didactics. Then we're having a cadaver lab with 10 cadavers. Every person will get to rotate with every faculty member for an hour. We're going to rotate the students instead of rotating the faculty. Day 2, we're going to do the exact same thing, but instead of a cadaver lab, we are live injecting, and that is going to be on and off label. The future of injectable therapy is going to be regenerative. It's bioinduction. And then the other big future is that it's from the neck down just as much as it's from the neck up. We're going to be talking about that because it's the people that are on the forefront of that will get to predict and shape the future. And that should be based upon merit and talent rather than on access. So MedSpa Network hopefully will provide access so that people's merit can shine.
So Dr. Durkin, tell me, what do some of the people who attend MedSpa Network, what is it like after they've attended one of your courses? So
most of the injectors that I meet that have not done advanced training are thinking through heuristics, through algorithms. It's an if-then equation. If this, then I do that. And that's good, but that's very limited. And there's a third dimension. There's an X factor, whatever you want to call it. There's a litany of names you can call it. That's what we're going to teach. The reality is different anatomic zones of the human face have different anatomic requirements and possibilities and risks. And specific biomaterials are going to outperform other specific biomaterials in specific areas. When you understand the performance of these different biomaterials, their mechanisms, and their rheology, and all the other components, that becomes demystified. And now you can truly transformatively create either with or without a scalpel. That is what we want. We are not providing marketing. We're not going to provide an algorithm. We're providing assets, intellectual assets for these practitioners to elevate their game. They're going to understand anatomy just the same way that I do. That's what they're going to get. Now, I'm not teaching a facelift, but I'm going to teach every vessel I think of every time I inject, because I do my own injections. And the reality is there are more similarities between surgery and injectable therapy than there are dissimilarities. We are altering anatomy. That is what we are doing. The more we do with anatomy, the more we understand anatomy, the better we're going to do. If we're going to use it with the needle, we got to understand the biomaterial. Then you got to marry those two things. You got to marry that with confidence. Once you're truly confident, that will project organically to everybody you see. So you're going to get that. You're going to get hands-on opportunities with anatomy. You're going to be seeing absolutely the cutting edge of everything that's happening with filler therapy below the neck. We're deeply excited about discussing why bioinductive dermal fillers are now 20% of the market. 3 years ago, they were less than 3% of the market. And we're going to explain why each bioinductive therapy has its place in the sun.
You touched upon a theme a minute ago that seems to be a really trending theme right now, which is this concept of regenerative medicine. Can you talk a little bit more about that and how that plays within your practice?
Absolutely. The future of plastic surgery is going to be regenerative just as much as it's going to be mechanical. If you consider a facelift, okay, which is my most common procedure, it's a mechanical repositioning of anatomy, but a facelift doesn't improve your skin. It will not. Picture a clothesline. You put a brand new clothesline out, and it's just tight and it's perfectly partitioned. 30 years later, it sags and it's frayed. What will a facelift do in that scenario? It will take that frayed clothesline and make it tight, but the frays are still there. That's a fail. I can't fix those frays with a knife, but I can fix it with a laser. I can fix it with radio frequency. I can fix it with microneedling. That's collagen induction. That's a biochemical event. I can do it with specific fillers. I can do it with both. That is the future, and that's regenerative. You're introducing agents that create a biologic difference in the patient, and then the patient fixes themselves.
I see.
That is regenerative medicine, and that's the future of aesthetics, whether we want it or not. I personally want it.
Sure. Another thing that you had mentioned a minute ago was, you were talking about, obviously with MedSpa Network as well, with training and education. Is that really what sort of attracted you of having or developing a partnership with Rohrer Aesthetics?
So that's a great question. Rohrer Aesthetics entered our practice after we already owned 4 laser platforms. We were early adopters of energy, in my opinion. We were early adopters of microfocused ultrasound. That really captured us. And then we had the privilege of meeting Mark Rohrer. He actually literally came to our office, and we looked at his portfolio. He provided remarkable data to us. And at first, I was skeptical, but I looked at his data. He didn't market with any, he didn't, subterfuge it with any marketing. The data was fabulous. And that the price point was too much not to be attracted to. There's a third the cost of everything else on the market, and there's no consumable. So from a business standpoint, that checked every box. And from a clinical standpoint, if it didn't improve my outcomes, it maintained everything I already had. And I wanted that. So we purchased one device, and within 6 months, we had 3 others. We now have a total of 4. And so we use them avidly. And then as we started our educational programs, again, post-pandemic, they contacted us because, again, industry also has an opportunity to elevate their game through education. And we had some experience with it. We had a fantastic clinical outcome with their platforms, and we have a good relationship with them. And so it was just organic. And they've been nothing short of instrumental and Herculean in helping us elevate our training platforms.
And speaking of training, could you touch a little bit upon your experience with the training and support that your practice receives from Rohrer Aesthetics?
Yes. So, from a support standpoint, I am happy to report I've had my Pixel 8 and the Spectrum we have had for 5 or 6 years. And I have never had to call support.
Wow. Well, that's something right there.
I know. The other thing is the service line agreement is next to 0. So I'm not just giving an annuity away to a company that's not calling on me. So we have excellent support from them, but the device is robust. I know for a fact if it goes down, I'm going to have it back up in less than 24 hours though. I know that for a fact, because if they can't fix it, they're going to provide another one. It's just their DNA. In terms of like the sales support and whatnot, it was a very easy process because we didn't have to put the entire Ponderosa in hock to onboard their new platform, which gave us flexibility to really market it and show people what it does. That elevates our opportunity to make it profitable and simultaneously to use it to elevate people's self-image. So it was just very, very easy from a sales standpoint. From a support standpoint, they're a phone call away. I've just never had to use the phone. So my experience with support has been absolutely magnificent. absolutely magnificent. If the thing doesn't break, that's the best support answer I can give.
Sounds great. Let's talk about results for a minute. What are some of your patients saying about the results that they're getting from some of the treatments you provide?
So the biggest thing people are looking for is convenience, consistency, and outcomes. So especially the Pixel 8 platform offers us good consistency, good convenience, and it provides excellent collagen with a minimum of downtime. What we hear the most on the microneedling side is it's convenient enough to fit in my schedule. From the laser side, what we're hearing the most of is this was worth my investment. And that to me means it's working. That is the biggest feedback we get. Now, the worst feedback we can get is I don't see any difference. And I am proud to say in our treatment protocols that we've developed, we don't hear that much.
So now comes the million-dollar question after all of the other ones. Out of the 4 devices that you have right now, which one is your favorite?
So it's a great question, and I'm not trying to be avoidant, but I believe that anatomy dictates appropriate use. I can tell you I actually love all the machines, and I think the one we use the most is Pixel 8. But really the favorite machine I have is the one that makes my patient the best. And so far, all 4 of them do that.
Dr. Durkin, thank you so much for taking the time to speak with me. I really appreciate it.
Thank you, Milan.